Aurora Healthcare delivers over 13,000 babies a year. And one of the interesting things that came out of this work, which was totally unexpected to me, was there's a new interest in how to assess babies for a certain congenital heart disease. We were able to have, through this AuthorSpace tool, a conversation with some thought leaders over the course of about a week and a half. And we had representatives from the northern part of the state of Wisconsin communicating with one of the lead pediatricians down in the south part of the area. And another person would bring in evidence from Metro Milwaukee area, from the Children's Hospital there. This kind of discussion allowed us in our work to say there's enough evidence here from our own thought leaders that we should change the way we deliver care for newborns in Wisconsin. Two of our medical centers have had CPOE in for a number of years, and they have about 50 to 60% of their orders are entered using computerized physician order entry. One of our medical centers just this past year went through the process with Zynx AuthorSpace to where they were part of building the order sets, and their adoption of CPOE since they opened a couple of months ago exceeds 90%. We've thought that the product, the AuthorSpace tool, which is what I've primarily been working with in developing content, is just a fascinating way to try to do work in a large health system where you're trying to bring together groups of people at times that are convenient for them to meet, share information, have discussion back and forth. And the AuthorSpace tool has allowed us to do that to where people can enter in their comments anytime, day or night, and review what others across the state have had to say about it days or weeks earlier. Our health system's committed to trying to be amongst the top systems in the country, and to do that we want to make sure we've used evidence-based medicine wherever possible. Having the evidence embedded into our order sets like we have helps us garner support for utilization from our physicians and other caregivers to actually implement the orders that we've got in place, helps to shape behaviors so we don't do some things that formerly had been traditionally used in a hospital or medical center.